Are Weimaraners prone to hip dysplasia? Weimaraners, with their striking gray coats and beautiful weimy eyes, are a breed of dog known for their grace and elegance. They are often portrayed as the perfect family pet, loyal, obedient, and protective. However, like any breed, Weimaraners may be genetically predisposed to certain health conditions. One such condition that concerns many potential owners is hip dysplasia. In this article, we will explore whether Weimaraners are prone to hip dysplasia and what steps you can take to help prevent it. Hip dysplasia is a common orthopedic condition that affects the hip joint. It occurs when the hip joint does not develop properly, leading to abnormal joint function. This can result in joint pain, lameness, and decreased mobility. Large and giant breeds of dogs are particularly prone to hip dysplasia, and there has been some concern that Weimaraners might be included in this group. To determine whether Weimaraners are prone to hip dysplasia, it is important to examine their genetic predisposition. Hip dysplasia has a hereditary component, meaning that dogs with affected parents are more likely to develop the condition themselves. Fortunately, breeders have worked hard to reduce the prevalence of hip dysplasia in Weimaraners by screening breeding dogs and implementing strict breeding guidelines. This has significantly reduced the incidence of hip dysplasia in the breed. Although Weimaraners have a reduced risk of hip dysplasia compared to some other breeds, it is still important to be aware of the potential for the condition. If you are considering adding a Weimaraner to your family, it is crucial to choose a responsible breeder who can provide necessary health clearances for both parents. These clearances should include evaluation by the Orthopedic Foundation for Animals, OFA, or the PinHip method, both of which assess the hip joint for signs of dysplasia. Another important factor in preventing hip dysplasia in Weimaraners is proper nutrition and exercise. Ensuring that your Weimaraner maintains a healthy weight is crucial, as excess weight can put additional stress on the joints, potentially exacerbating hip dysplasia. Feeding a high-quality diet that meets the specific nutritional needs of the breed is essential for overall joint health. Additionally, regular exercise helps to keep the muscles that support the hip joint strong and flexible. While the genetic predisposition and responsible breeding practices have reduced the likelihood of hip dysplasia in Weimaraners, it is still possible for individual dogs to develop the condition. If you notice any signs of hip dysplasia in your Weimaraner, such as difficulty rising, lameness, or reluctance to exercise, it is important to seek veterinary attention promptly. Early diagnosis and intervention can greatly improve the prognosis and quality of life for dogs with hip dysplasia. In conclusion, are Weimaraners prone to hip dysplasia? While they may have a reduced risk compared to some other breeds, it is crucial to be aware of the potential for the condition. Responsible breeding practices and genetic screening have significantly reduced the prevalence of hip dysplasia in Weimaraners. However, it is still vital to choose a reputable breeder who can provide health clearances for both parents. Additionally, maintaining a healthy weight, feeding a proper diet, and providing regular exercise can help prevent or minimize the impact of hip dysplasia. By being proactive and informed, you can ensure that your Weimaraner enjoys a healthy and active life.